Welcome back to your cariboudatascience channel, Australia, and a particularly big shout out to the 15 people who viewed this video yesterday. Thank you so much, you 15 folks. Of course, now I have a favor to ask, and that favor is, of course, click on that subscribe button, click on the like button, and most important, I'll click on the share button. Share this video on Facebook and Twitter. You can also copy and paste a link to the video into an email or text message, and share it with your friends and family today. Before we get started, I do have one question for you to consider. That is, suppose COVID-19 never goes away in Australia. Suppose it never goes away. How many deaths are going to be acceptable a year from COVID-19? Okay, let's get on with the show. Australia's numbers have been for a good while, have been very low, but for some, you had a slight hiccup in the cases and to a lesser extent deaths, and you immediately go back into lockdown. Okay. I'm just not sure how this is actually going to really solve the issue. I mean, they only had a total of 33,000 cases, if that's correct, 918 deaths. So here you can see the this increase, which began, let's say around May 24th, now has spiked at 164 cases for a single day, and a 7-day average of 127 cases per day. But here's the problem. Look at the deaths. 2 deaths, really? You have 2 deaths on 7/24, and you're locking down the economy again? I don't know. I don't know. Here you can here you can see again. You can see this 4 or 5 week increase in cases. We come down here and look at these numbers down here for the weekly numbers. If this is 50, this is 25. So this may be at the most 10 deaths per week for these periods right here. Then there's nothing here. So my question for you is, why are you locking down? Why are you locking down? What happens if it never goes away? Okay, you can see there was a problem so far in July with an increase of almost 2,500 cases, but that doesn't mean the next month's going to be 2,500. And then we need to remind ourselves of something Washington University's Institute of Health Metrics and Education have said. That is, the single best measure of the spread of a pandemic is daily deaths, not cases and not hospital beds. So don't be led astray. Look at the deaths for July. Okay? What's this? And this is the number of cases per 100,000 people. Well, you have about, this is one person per 100,000. Okay? This is a half. So right now, say about a half of a person, of 100,000 people, a half of a person has COVID-19. What about deaths? Well, look at your deaths. You can't even see the numbers there. They're so low. Okay. And then there's this, now this, and now I'll be honest, this could be a bit of concern, but not a big concern. But look at this flattening you had here. Are we just going to see the same pattern, flatten and climb? Well, at what point do you say, you know what? We've reduced them as much as we can on average. Okay. And look at this. What are you locking down? I don't understand. What are you locking down for? Okay. This is as far back as January 20, you had this lockdown. And before this period, you didn't have that many cases anyway. You had 2 waves. Okay. So anyway, thanks so much for stopping by today, Australia. We'll catch you tomorrow with an updated report. As always, again, a big shout out to the 15 people who viewed this video yesterday. Thank you so much. Now I need you 15 folks to click on that share button. Share the video on Facebook and Twitter today. You can also click on that share button, copy and paste the link into an email or text message, and share that with your friends and family today. Thank you so much for your time. Catch you tomorrow with an updated report.